is joining us, and we're happy to have him back. He's an epidemiologist and associate professor at the University of Ottawa. Good morning. How are you?
Good morning. I'm fine.
We're all kind of questioning, and I guess it gets down to individual responsibility. It sounds great, but we're heading into an unusual time. We're seeing these cases skyrocket in some places or just merely start to go up around the world. We're lowering restrictions. Things could start to go up here. What are you looking for here, and how do you feel about it? Are you optimistic?
I'm always optimistic, but cautiously, and I think we're lifting restrictions a bit too early, frankly. If you look at Ontario, for example, we enacted mask mandate when we had about 150 cases per day, and we're taking the masks away, and now that we have about 2,000 cases per day, which is interesting. But on the other hand, we have pretty good vaccination rates, and the vaccines are excellent at keeping people out of the hospital and out of the morgue. So that's good news. Um, am I optimistic? I'm optimistic because I think people have the tools that they need to navigate risk accordingly. However, I'm concerned about those people who are at the low end of the socioeconomic scale, because risk isn't shared equally across the population. People who are immunocompromised, the elderly, the poor, those with kids who can't be vaccinated are still at particular risk.
As everybody decides what they want to do and what they don't want to do, I just want to ask you, if you're walking in, I'm going to wear a mask if I go to the grocery store. I don't feel it's a big deal and I want to protect myself. I don't want to get this. If I'm wearing a K95, a fresh K95, does it really protect me from the air? And if so, how long?
That's a good question. It does protect you, and the difference between a KN95 an N95 versus three-ply surgical mask is that these respirators, the N95 and KN95s, are very good at incoming protection, whereas the other ones are good at source control, the exterior protection. So with the surgical mask, my mask protects you, your mask protects me. With the N95s and KN95s, those masks protect both other people and you. So the question is, how long? Well, there's some simulation studies that suggest that if someone close to you is infected, it may take hours to get an infectious dose if you're both wearing KN95s. If only one of you is wearing KN95s, it takes fewer hours, but it's measured in hours probably. With Omicron and BA2, that number comes down significantly. But again, these are averages based upon laboratory studies. But you can be pretty confident that an N95 and KN95, when worn properly and fitted well to your face, will offer some very good protection, but not indefinitely and not perfectly.
Yeah, that's what I thought. So kind of move in, move out, block your time, and get back out and find yourself some fresh air. I want to ask you what metrics we're going to be looking at. We all got used to them, ICUs, cases, and now, as you say, are we really paying attention to that? There's the political interpretation here because they're the ones that set the restriction policy. And we have a sense that people are tired of it and the will of the people and all that. But we also know science doesn't really care about that. So what are we going to look to here? Is there a fear, I'll use that word, that people may not respond even if we need to have more restrictions?
Yeah, it's a really good point. And it's a lot tied up in that question. First, the metrics. Well, traditionally, there are three categories of metrics we looked at. The epidemiological ones, which are number of cases per day. We don't have that info anymore because we don't test as well. We don't contact trace as well. There's also the population indicators, like the vaccination penetration rate, which seems to have plateaued. Then there are the health systems indicators, as you mentioned, the ICU capacity and so forth. We can measure that pretty well. So right now, what most of the modelers are doing are looking at wastewater surveillance, which is fairly objective, and some of the surveillance that's done in the hospitals. So when someone walks into a hospital for whatever reason, they're given a COVID test, and that data is available. That's we call that sentinel surveillance. That's pretty useful too. So that's what we're mostly monitoring. But the larger question about how do we use this information to gauge public compliance and so forth, that's pretty important because a lot of the modeling assumes a level of public compliance, a percentage of people who are still wearing masks, for example. And the best way to do that, of course, is to just do random surveys of people or take a guess. Frankly, we don't know, and it's going to be difficult getting the appropriate data to make these kinds of decisions as we go through. So much of this pandemic has been driven by data, information. We have less of it now, strangely enough.
Thank you. Have a great weekend, and we appreciate your guidance. Dr. Raywat Deonandan, who is an epidemiologist and an associate professor at the University of Ottawa.